Hello and welcome back. Once again, I am Ashok Rajguru, your tutor. In this video, we shall try to examine what is the kind of support that we can give to our patient presenting with lupus. Apart from remedies, what the patient needs is immense amount of support, psychological, mental, social. That is why the patients are coming to us. One sad fact of modern medicine is that all the doctors, all the pharmacologists are engaged in looking for a cure. And what the patients really are asking for is care. Sadly, this has also crept into homeopathic practice, and we must overcome that by providing patients care. And that is exactly what is meant by support, and we shall be examining some ways of providing that support in this video. Disease is what the doctor sees, and illness is what the patient feels and suffers. So if we have to provide care, if we have to heal the patient, we should be able to empathize with the suffering that the patient is undergoing. That is extremely important. So the objectives of this video are to discuss some resources which can support healing. And this is not limited to the case of lupus only. We will be able to use this methodology in virtually every case, especially those of chronic diseases. We must learn to think beyond remedies. Sadly, everybody seems to be only chasing remedies, but that is not what Hahnemann had exhorted us over and over again in a number of aphorisms. He had said that the physician is also the sustainer of health. So we must be able to provide information relating to nutrition, lifestyle, guide the person into ways and means that will help him to overcome the pain and to avoid its recurrence in future. So it's very essential that we understand the difference between healing and curing. Each one of us who comes to the profession of the healing arts is really a wounded healer. This term, wounded healer, was coined by Carl Jung, and he was taking inspiration from the mythological story of Chiron, a Greek character in Greek mythology, which you can read up yourselves, and I'm sure you will be able to find many parallels between your own personal life and that described in the Greek mythology. In this particular video, we shall be looking at a technique known as guided imagery or creative visualization, also called simply imagery and visualization. These are very powerful techniques and have been found to be very effective, and I shall be talking more about it in the videos that follow. Imagery really is all about awakening the inner healer, the inner intelligence in each one of us to heal ourselves. When the vital force has been overcome by a derangement caused by some external causes, then we have to awaken the inner healer by various means. Remedies form one part of the story, but there are other means as well which we can use to our advantage. Imagery or creative visualization is in fact an accepted part of nursing practice. As a matter of fact, most medical books written on this are written by teachers who teach in nursing colleges and nursing universities. So first of all, what exactly is imagery all about? To define it very briefly, imagery is a perception. Imagery is a perception of a stimulus in the absence of a stimulus. In other words, there is no real stimulus, but a person can perceive that stimulus through the process of imagery. In this video, we shall talk more about this in the next few slides. This graphic on your right shows the picture of a sliced lemon. I'm sure the moment you speak the word lemon or you look at this picture, there is something happening inside your mouth. To take this further, you can just relax and close your eyes. After you have closed your eyes, bring the image of a lemon in your mind's eye and dwell on it for a while. And then observe your sensations. Try to visualize the juice of the lemon touching your tongue and keep watching the sensations that you are able to feel on your taste buds. I am sure most of you will feel yourself salivating. A very common experience, isn't it? But that's what imagery is all about. Let's look at some clinical facts on imagery. Imagery essentially is the absence of a stimuli, but which gives a physiological outcome, like the one that you experienced in the previous slide. Just the very thought of the juice of lemon trickling on your tongue will be able to tickle your taste buds and cause a physiological reaction. There is one big difference between a placebo effect and imagery. In a placebo, a patient thinks that he is taking medicine. He is under medical care and he is taking medicine. It's only the physician who knows that it is not a medicine, but it's a sugar-coated pill or a sugar pill. However, the physician or the person who is administering the placebo is giving the suggestion to the mind of the patient that he is taking medication. So, putting it across simply, it's actually the suggestion of the practitioner that affects the outcome. As compared to that, imagery is quite distinct from thinking. I'll repeat once again that in the case of a placebo, it is the thinking of what is going on in the mind of the patient that is affecting the outcome. But in imagery, it is quite distinct from that. It's not about these mental pictures. It's actually a bridge between the conscious processing of information and a physiological change which you are able to perceive directly. The image making function of the brain is actually able to cause an entire physiological action in whichever region that the person wishes to do. I would recommend all of you to refer to this book, Holistic Nursing by Barbara Dossey and Lynn Keegan. This is an excellent work on this subject from the clinical and practical point of view. The book tells us that research has confirmed the efficacy of creative visualization and guided imagery in many aspects of recovery, especially wound healing. Also, in the case of regulating the response of the immune system, it has also helped in blood pressure and heart rate. And a lot of people suffering from many other conditions, including osteoarthritis, have benefited tremendously from this practice. So please take a look at this book. You can read excerpts of this book on Google or on Amazon, but I'm sure you'll find this book to be very handy and useful to learn the techniques, because only then you can guide your patients after you have taken an experience of this process yourself. Another excellent reference is a book by Dr. Jerry Epstein, who is basically an MD. He was a psychiatrist, and he happened to meet a practitioner who was teaching healing visualization and healing people. I'll not tell the whole story, but he's got a very good website with a tremendous amount of information. And this book will prove very handy if you have to guide your patients through specific visualization techniques. This book is Healing Visualizations, and the subtitle is Creating Health Through Imagery. As I said, Dr. Jerry Epstein was a psychiatrist, a researcher, a professor in a university, and a consultant at the famous Mount Sinai Medical Center. Also, he teaches at the Columbia University, a very prestigious university in the United States of America. Now, here are a few words about placebos and placebo trials and the effects of placebos. Now, allopathy tends to overvalue diagnosis and treatment. And surprisingly or ironically, that itself is a placebo. The fact that you are suggesting to your patients the amount of research and the efficacy of those drugs is itself a placebo. And each successive generation in medicine has introduced new placebos. Why is it that the old placebos don't work later? You always need new placebos for the simple reason that strong suggestion of cure is coming from those allopaths themselves. Now, in order to use these techniques, you have to prepare yourself. It is much like the medical school education you might have undergone as a medical practitioner or as a homeopath. First of all, practice makes perfect. So you should use imagery as a therapeutic adjunct in your practice routinely. But before you do that, you should get an experience of that yourself. So you must learn to meditate and incorporate meditation in your lifestyle. I'm sure I don't need to repeat what is already known to all of you, that meditation improves your creativity, your intuition, your awareness, and empathy. In order to be a successful homeopath, it's not just a question of learning how to use the repertory or learning by heart or by rote all the rubrics and the indications of a remedy. There is a lot of intuitive work that goes on inside your mind, and you have to be very aware and empathetic to the suffering of the patient. And the best way to reach there is through the practice of meditation. There are many styles of meditation, and you'll have to dabble with a few before you find one that suits you best. In a later season of these series of videos, I shall make a presentation on meditations that can help you in order to teach visualization and imagery to your patients. So you must learn to use imagery in your own personal life, whether it is regarding your career progression, your success in practice, or wherever you wish to see yourself as a practitioner. Also, you'll have to learn how to train your voice in order to convey calmness and reassurance and trust to your patients. That is, of course, a key to success. As a matter of fact, a lot of research or clinical trials that have been done by allopaths try to put across the impression that it's merely the visit to a homeopath and the fact that the homeopath listens to the patient helps in the cure. Well, if that is so, we should be able to master that technique. So you must learn to train your voice to convey calmness, reassurance, and trust. And the two books which I referred to you will be of tremendous help for you to learn imagery scripts. Much as you have scripts for clinical hypnosis, you can have your own scripts, but a good guidance for these imagery and visualization scripts can be found in the books which I have already referred to. Now here are a few guidelines that will help you to use imagery in your practice. First of all, you should identify what has to be suggested in the imagery. Most often, people who are suffering from chronic diseases have forgotten what their symptoms and modalities are. They had those modalities and they still have them, but somewhere down the line in the course of the evolution of the chronic disease, they have just either overlooked it or accepted it as part of life. So you have to awaken that part of the person's mind. So you will have to choose words that have meaning for that person. There are no standard scripts. The scripts can only guide you as to what can be the content of the script that you're giving to your particular patient. Another very useful guidance is you must use words that have less emotional impact. For instance, the word discomfort is a better word instead of pain, because pain is a reminder of a lot of unpleasant things in life. Also, we must reframe negative imagery with positive, healthy, and wellness associated words and phrases. So rather than using disease or sickness, we should be able to use better words which convey health and wellness. Another thing that you must remember in your mind is that if you apply deep relaxation and breathing techniques to guide your patients to a relaxed state first, it will help you tremendously. You are aware of the metaphorical couch that is used by practitioners of psychotherapy and by counselors. There is no reason why we should not use the same techniques to our benefit in order to put the patients at their level of comfort. In the next slide, you will hear a typical script of guided imagery by a practitioner of clinical hypnosis. The person's name is Anjali Rajguru, and she guides people into meditations. She's a yoga teacher and a yoga therapist, and also uses the techniques of creative visualization to help people overcome not just health issues, but many other issues as well. In a separate video that follows this one, you will be able to watch a guided imagery session. It's really an audio, but I have separated it from this one in order to keep the lesson size within the stipulated time. So thank you very much for your attention, and I hope this will help you in order to assist and guide your patients in their path of recovery. Please let me know your comments on the forum, and I'm sure the discussion that will follow will help you understand the subject much better, because the forum is a place where other students, other listeners, and other practitioners will be able to contribute from their own personal experiences. So once again, thank you very much, and bye-bye.